You started recording? There we go. You have. Awesome. All right. If this is your first Lunch and Learn, thanks for coming along. Let us tell you a little bit about ourselves if you don't know about Thrive or you haven't heard from Kath or myself. But we started Thrive Aged Care now, I think it was nearly 2.5 years ago, with the view to really support those organisations and teams that work with older people. Yeah. So working with organisations and teams, sharing expertise, building skill, knowledge, and confidence through training, education, mentoring, and working in partnership with organisations to really review and improve the services and the offerings that we have for our older clients. So that's a little bit about us. We run our free monthly Lunch and Learns every month on topics that are relevant and interesting for you guys, the guys supporting older people, whether it's in healthcare or aged care. So thanks for coming along today. My name is Kate Lamont, and I have got Kath Kirby, co-director at Thrive, monitoring the chat and letting people in. So if you've got any questions, pop them in the chat. We'll have some time to go through them at the end. Now, we are recording this session. You can share it with your colleagues and your networks, and we will also send you a copy of the slides that you see today as well. We've just asked that you pop yourself on mute for the session, but like I said, we'll have the opportunity to stop the recording and have some questions at the end. And please make good use of that comments and chat function. We do have a few questions that we'll ask in this presentation, so we'd like it to be interactive. Now, before we get started, we do understand that this topic may potentially be upsetting or uncomfortable for some, and if that's the case, feel free to take some time out, or feel free to stay on afterwards and have a chat with us as well. Now, I guess a disclaimer is I'm not a mental health clinician, and nor is Kath. I'm an OT and Kath is an RN, and our area of expertise is supporting older people and organisations that work with older people. We have collaborated with quite a few different mental health clinicians in the past, but this session is really just to get you guys thinking, people who work with older people in acute or subacute or community or aged care settings, about how you can support positive mental health and how we can enhance our skills in supporting people who might have ill mental health as well. Now, a little bit about the strengthened aged care standards that are coming in on the 1st of November. And these are relevant for residential aged care providers and also home care providers. Yep, support at home. And they have a particular focus on mental health, which is fantastic. Yep. Much more of a focus than the current standards that we're operating in. And you'll see that in Standard 5, which is all about clinical care, that we must identify, monitor and manage high impact, high prevalence risks. And we would consider mental health as one of those clinical areas where we have high impact and high prevalence risks. And specifically about mental health, that we should have processes in place to optimise mental health. So there is a focus on how we can actually promote good, positive mental health for the older people that we're supporting by actively promoting mental health and wellbeing, by making sure that we respond to signs of deterioration in a person's mental health, that we respond supportively when someone's in distress or they have symptoms of mental health, including self-harm and suicidal thoughts. Yeah. So today's session, in the 30 minutes that we've got, which is not a long time, but we're really going to just think about how we optimise mental health. We're going to start with the stats. We always believe at Thrive it's important to start with the why, and we need to know why this is such an important topic. We're going to talk a little bit about identification and monitoring, and we're going to think about how we can actively promote older people's mental health and wellbeing, regardless of what setting you work in as well. So let's kick off and think about some of the stats. Now, on this slide here, you'll see some stats for older people living in the community. Okay, so it's quite significant. Mental health conditions are common in older people living in the community, with about just under 8% of men and just over 11% of women aged 65 and over having experienced a mental health condition in the last 12 months. Okay, and that's for people who are reporting that. And like I said, these are general stats for people living in the community. We know that people who receive aged care services, both at home and in residential care, actually have a significant risk of ill mental health and have experienced greater episodes of ill mental health. So let's have a look at that now. So when we look at home care, we can see how these stats have increased. So for older people aged 65 and over on home care packages, they have a 23% have recorded a mental health condition on their aged care eligibility assessment. Yep. Remember the general stats that we had for people living in the community aged over 65? It was about 8% and about 11%. And now we're looking at 23% for people aged 65 and over. It is even higher for people of Aboriginal and Torres Strait Islander background who are aged 50 and over, yep, on home care packages. We know that mental health conditions were more commonly recorded for people who were living at home alone at time of their aged care assessment as well. Now, when you look at the graph on this slide, it actually shows you the source of diagnosis. And you can see that just under 18% of clients are self-reporting a mental health condition. GP confirmed is the highest, just under 40%. And then you've got hospital confirmed just under 30% as well. And that's really interesting to hear where the source of that diagnosis is coming from. All these stats are from an AIHW mental health into aged care report that was conducted over 2017 to 2022. And we'll have a reference link in the end of this slide pack for you as well. Now, when we look about those people living in residential aged care, the stats are really interesting as well. Yep, they increase even more than people who are on aged care packages in the community. You can see this slide tells us that just under 60% of all people aged over 65, and it's a very similar stat also for Aboriginal and Torres Strait Islander people who enter permanent residential aged care, were recorded with a mental health condition on their aged care eligibility assessment. That's huge. So it's about 3 in 5 aged care residents having a mental health condition. Okay, so have a think about where you work. If it's in residential aged care, it's likely that 3 in 5 of your residents have a mental aged care condition. Yep. Aged care residents are also 4 times more likely to experience ill mental health than people living in the community. Yep. And we know that about 50% of people in residential aged care have depression. Yep. Just up to 20% have a diagnosed anxiety disorder. And then this stat is huge, with about 60% of people who live in residential aged care having anxiety symptoms. So not an official anxiety disorder, but showing anxiety symptoms, okay? And those symptoms, requiring care, support, and treatment. Also, 1/3 of people living in residential aged care report suicidal ideation, and that's 4 times higher than for people living in the community. Okay, so when we hear these stats, it makes sense why there is a focus in the strengthened aged care quality standards on mental health. Yep. And why we really need to think about it when people are assessed for aged care packages and when people come into our service as well. Now, when I was looking at that AIHW report, I found these stats and I found them really interesting, and I wanted to share them with you. So these stats, this graph here, is all about mental health assessments that are completed as part of aged care eligibility assessments. Okay. Now, this was completed for the time frame of 2015 to 2022. Okay. So before we've gone to this new model that we have now, which is a single assessment service. But what you'll see here on the left is the geriatric depression scale. And then you've got another assessment tool called the Kessler. And what I find so interesting is the area in the black that I have circled is the percentage of mental health assessments completed as part of an aged care eligibility assessment. What are your thoughts around seeing these stats? I put them in here because I was shocked and surprised. I would have thought that knowing how prevalent mental health conditions are for older people, that most people would have some sort of screen or some sort of assessment when we're looking at aged care eligibility. But you can see from these stats here that that is not the case. In fact, very few people have formalised assessments on eligibility. Yeah. Now, look, that might have changed with the single assessment service. We hope that is the case. But just to keep this in mind as food for thought, we're getting people, who are telling us they have a diagnosis. We're seeing perhaps that they have a diagnosis from a GP referral or GP documentation, but not a lot of people are necessarily having a formalised assessment on that aged care eligibility pathway. So now I want you to think about wherever you work, okay, whether it's in residential aged care or the community or in healthcare. How often do you screen and assess mental health for your residents or clients? How often are you doing that? Pop your comments in the chat. And I want you to also answer this question: what impacts on timely screening and assessment around mental health for your clients? What impacts? What helps you do it? What is a barrier for you or your teams doing it? And we'd love to see your thoughts around that. I'm just going to open my chat up so I can see what's coming through. Is everyone screening on admission? Has anyone got any processes set up where you're doing screening perhaps at certain pathways, certain timeframes? Yep. Thank you, Ruth. With a diagnosis of depression every 3 months, if no diagnosis. If someone has a diagnosis of depression every 3 months, fantastic. And if no diagnosis, you're screening annually. Yeah. Not much attention to this area. Yeah. And why do you think on admission, it's all coming through, resident of the day processes every 2 or 3 months or when there is a change noted in mental health? Someone else works in a dementia-specific unit and undertakes specific depression screens on a needed basis on admission for baseline and then fortnightly or monthly. Great. We do PAS and Cornell on admission. Thank you. Yeah. And does anything impact timely screening or assessment for mental health? Anything impact it? Anything stop you from doing it as often as you would or you think you should? Or does anything even enable it? Anything help you get it done? What are your thoughts around that? Time, knowledge, or ability to spot changes, fantastic. Staffing, yes, staffing. It might be number of staff or it might even be knowledge, staff knowledge, staff confidence in completing screens or assessment tools. Yeah. And Natasha, I think you're so right. The ability to spot changes, because that's often our trigger, isn't it? Yes, we do a screen or we do an assessment when we see changes, but we have to see those changes. We have jobs allocated daily. Great. So that's an enabler, making sure it's part of positions or jobs. Yeah. Some staff are uncomfortable doing the assessments if related to mental health as they are not mental health professionals. Exactly. Yes, exactly. It's tricky, isn't it? If you feel like you've You've not been trained in mental health, and now you're doing mental health screens or assessments. Yep. And can make you feel a bit uncomfortable. Yep. Paul, thank you so much for sharing those. So these are some of the tools that are available to help you and your teams in terms of mental health screening. And there's a link down there to ARIA where this has come from. Okay, so many of you have mentioned some of the scales that you use. The Cornell, I think, was mentioned. The GDS, Geriatric Depression Scale, Mood Questionnaire. There's also the Nursing Home Short Depression Inventory. And then there's two other tools available there specifically around anxiety. Okay, some of these you might be familiar with, some of these you might not. But the reason I wanted to share these with you is sometimes time can be a factor as to why it might be hard to screen for mental health or assessment. And you'll see that these scales quite often have different versions. Yeah. So for instance, when we look at the GDS, there's actually an 8-item version and there's a 30-item version too. But the 8-item version can take 5 minutes, whereas the 30-item version is still quick at 15 minutes. But different tools might be relevant for your teams who might be busy to help quickly screen for changes related to depression or anxiety. So I think it's really good to be familiar with these screens. But there is absolutely no point screening if you're not taking action. And I think what you've raised in the chat is, in order to feel confident and comfortable screening and then to be able to take action, staff need training about mental health and well-being. They can be trained in how to use a tool, but if you're not trained in why you're asking those questions and what the answers might mean and what you do with that information, you're not going to feel confident in that space to be able to identify changes, to escalate them, and to know how to respond. So filling out the tool is kind of like the pointy end. You kind of need all that information to understand the why, especially when you're not a clinician who is a mental health clinician, which I'm guessing most of us today, are general clinicians, not specifically trained in mental health, yet doing screening tools or doing assessments. So it is really important to help people understand the why in order for them to feel capable and confident. Now, these new standards aren't asking people to become mental health experts, because absolutely not. Yeah, in residential aged care, we can't be experts in absolutely everything, but you can be an expert in how you can best support that older person that you're working with. Yeah. And without being a mental health expert, you just need to be able to know how to identify risks, how to identify changes and feel confident that something has changed. And I know what steps to take to get a little bit more information around the changes. And then I know how to escalate that. Yeah. And I know where to go for help. That's really important too. I know that there's specialty services out there that can help provide a bit of support. And I have some confidence and I have some knowledge and I have some skills to be able to have that conversation with the person I'm supporting, your client or your resident or your teams, and to be able to follow that up. These are the areas that we need to develop skill and confidence in able to support older people with mental health challenges. Yep. It's not about becoming a mental health expert. It's becoming skilled and confident in these areas. Now, the standards also touch on supporting people who are in distress and avoiding crisis, and that includes when people are they maybe have thoughts of self-harm or suicidal thoughts. Okay, and the next slide, just to let you know, we'll discuss suicide. So these stats are from 2018, a Monash inquiry led by Professor Joe Ibrahim, if you know of him, which reviewed coronial inquest data. Okay, and what it found is for home care packages, 21.5% of 21.5, of 100,000 users committed suicide. Yep. In RAC, it was 12 per 100,000. So we're seeing more people who are on home care packages than necessarily in residential aged care. Now, these are both quite significant because for Australia, the general average suicidal prevalence across all ages and in Australia is a rate of 12.9 people per 100,000. Yeah. So you can see home care packages is significantly higher than that. And residential aged care is about on par with that. Yeah. More prevalent in men and less common with increasing age. That's why you see a drop off for that residential aged care. Yep. The 12-month period for people entering residential aged care was identified as a very high risk period. Yep. And for those people in residential aged care, where they reviewed coronial inquests around suicide, the prevalence was male, very high male, just under 70%, and 76% had a diagnosed mental health illness, and the most common was depression. So here we can start to see, I guess, some risk factors. And some of the other common risk factors were, number one was a deterioration in health, nearly 80%, isolation and loneliness, just under 50%, and poor adjustment to residential aged care life. So here you can see some of the stats related to suicide for home care packages and residential aged packages. And it is something that we must become aware of because it is a very high prevalent risk that we need to be able to identify and then have some skill in knowing what to do. Yeah. So I want you to think about where you're working and do your teams, do they have this skill? Firstly, to identify when someone might be in crisis and to be able to respond when they're in that crisis, and to know of what escalation processes are around for people who are in crisis, whether you're supporting people in the community or you're supporting people in residential aged care. So if you want to pop your comments in the chat, it can just be a thumbs up if you think you've got skill there, or it could be, I think it's an area that we need to develop more skill. Need development for more, yeah, most stuff. Thank you, Kathy, and thanks, David. Great. So Ruth, you definitely know your process. Yep. More skills needed. Yep. So it's great that there's processes in place and you've got access to aged care mental health experts, which is fantastic. But definitely need development for most staff. Yeah, most skills. Mental health first aiders, awesome, but there's room for improvement. We could do for some increased skills for team members. Certainly, yeah. It can be, again, a space that people can find confronting, can find really tricky to have that conversation and to know how to get how to get more services and support for people. And I think especially for people who are supporting people in the community, we know that the risk is greater in the community. Often you're out by yourself supporting that resident, and sometimes you might not want to leave that person because you've identified the risks and you know that person needs support quite quickly. So I think, yeah, especially for community, but residential aged care as well. Thanks for engaging in the chat, guys. So, food for thought. We really do need to switch in from being reactive to proactive. Yeah. Traditionally, I think health and aged care, we do operate sometimes in a reactive approach. And I can hear that quite a few of you are shifting to proactive, where you've got really early and good and regular screening in place. But proactive means promoting health and well-being, yeah, not just early identification. That's really important as well, but it's an additional layer. How do we actually promote good, positive health and well-being, not just responding when people are at times of crisis. Yeah, it's a balance of both. So what does positive mental health and well-being look like for your clients? Pop some words into the chat for me, okay? Because this is a focus of the strengthened aged care standards. It's not enough just to be able to identify risks and escalate risks and respond to crisis. There's also an element of actually promoting positive mental health for older people in aged care community settings and in residential aged care. So what do you think that looks like for your clients? Oh, awesome. Engaged in community, social supports, being happy and engaged. Yeah, that social link is so strong. Being happy with staff. Yeah. So having that connection and support with staff, variety of activities in the facility. So having things that I want to do that give me meaning and purpose. Amazing. Fantastic results. Keep bringing them in. Thank you. Family and pets. Pets are so important. Doing what I want to do. Engaging. Oh, the word engagement. Yes, you're onto it, guys. So we all have a role to play. And it's not just a leisure and rec role. You know, some of those things that we spoke about, activities and engagement, that's for everyone who supports older people in aged care, because that's a focus that we should have. So really, here are some of the things that link to feeling good and functioning well and having that positive, optimal mental health. And it's about having positive emotions, positive relationships, which you guys have identified, engaging in life, having that sense of meaning and purpose is so important. And I think that's why the 12-month period into residential aged care is a high risk period. Emotional stability, having resilience, optimism, self-esteem and vitality. And all those things that you talked about don't just sit in standard 5, which is where mental health sits in the standards, but they sit beyond that. You know, think about standard 1, the rights-based aged care framework that we're moving towards. Think about standard 7, the residential aged care community. It's really encouraging independence, maintaining function, that sense of meaning, purpose, and having choice and having control over your life. So that all links into having optimal mental health. So what things, this is to challenge you guys a little bit, what things could you do differently to promote positive mental health and well-being? And that's something for you to take away. You can answer it here, but also to take away and think about it with your teams. What things could you do differently to promote positive mental health and well-being? If you work in community aged care or if you work in residential aged care, what could you do differently? Now I've got 2 minutes, so I'm going to push on, but I hope to see those comments coming through. Oh, they are amazing. Provide more opportunity for engagement. Find out from residents what would make them happier. Beautiful. Yep. Keep those ideas coming through because we can all learn from each other. We can all see those comments in the chat and we can all learn from each other. But here are some things for you guys to consider. Go away and have a think about what training do you currently provide to staff on mental health? Is it just for some staff? Is it just your clinical staff? Should you be training people a little bit more broadly? Should your support staff, your non-clinical staff, actually have some understanding about what to look for as well and how to escalate their concerns? Are your staff skilled in being able to identify the signs of deterioration? And do they have the skills to respond? How do you promote positive mental health and wellbeing for your clients and residents? And what specialist mental health supports or services do you have? And do your team know how to access them? Because you might go, yeah, we've got that process and procedure, but are you completely confident that everyone knows how to access that on the weekends, out of hours, when you're not there, when, you know, key people aren't there? Is everyone on the same page with how to access services in a timely way? Here are some links to services that might be useful, and we'll send through a copy of these slides. One that we've recently heard of that you guys might be all across, but we thought it's worth sharing, is the Victorian Virtual Specialist Consults service. This is an addition to the Victorian Virtual ED. And it includes older adult psych consults. And my understanding is it's a clinical consult for the person and also a consult for the team to help talk about what strategies might work supporting that older person as well. So something to think about if you are struggling to get on-site support. So a bit of a summary. I know that we've hit 1 o'clock. So hopefully we've given you a little bit of food for thought about why the focus on mental health is important and maybe made you aware of some of the stats that you weren't aware of, and have given you some links to some different screening tools that you might be able to explore and have a look at with your team, and to give you a bit of food for thought about what could you do a little bit differently. Okay. We will pause the recording and we will open it up for questions. But before we do that, just to let you know, we do still have some places coming up for our Not Your Average Aged Care Conference, which is the 18th of September. If this is of interest for you, it's a day where we can get together as aged care leaders and really pause, plan and prepare for the upcoming standards. We are going to have a session in this conference on mental health as well. So reach out if you're interested in finding out more about that or booking some tickets. And we also do offer older persons mental health first aid training here at Thrive. So we offer this training for organisations. So if you're interested, this is an accredited 2-day course. Vanya Simic, who's on the call here with us today, she is our certified trainer in this space. So some of you mentioned that your staff have got mental health first aid training. This is specific for older people, which is fantastic. Kathy and I have done the course and highly recommend it. So if it's something that interests you, reach out to us as well and we can have a chat. But we will, oh, there we go. We've got our feedback slide. This takes 2 minutes to complete, and it just tells us what you like to hear about in these lunch and learns so we can help plan content that's relevant to you. But thank you so much. We will stop the recording now. And if you've got questions, hang around and we can have a chat.